will object. Undercutting, rust proofing, factory surcharge, or delivery fee. See website for details.
Ocala's information station, 1370 WOCA.
Ocala.
All right, 5 minutes after 11 o'clock. If you were sleeping for the last 20 years or so, well, first of all, good morning. And second of all, so many things have changed in our world. And one of the things that has changed is how we deal with our physical bodies and how we correct things that maybe are not quite right with them. And one of the big issues you always hear about in America, and I don't know why it's America, but apparently it is we are an obese nation. And sometimes it's out of control. And sometimes out of control means literally out of control. There's no way to control it. And there is surgery called bariatric surgery. I hope I'm saying it right. I am all the student and not the teacher at all in this subject. Robert and I do know a few people who have had bariatric surgery and have had beautiful results. I mean, beautiful results. Lauren Debick is in the studio, and Lauren is the manager of marketing communications at Ocala Health. And Lauren has brought into the studio Dr. Reginald Griffin, who is a general surgeon specializing in minimally invasive, I guess that's important, 2 words right there, minimally invasive bariatric surgery at Concierge Bariatrics. And so good morning to both of you.
Good morning.
Good morning. To see you. Thank you for bringing in another great guest.
Absolutely. Thank you for having us.
Oh, you're welcome. So is this what you do all day long? You is part of your day speaking to people who might be candidates?
Absolutely. I talk to people on a daily basis who are interested in bariatric surgery and explain to them all the risks and benefits and to see if they're an ideal candidate. So it's certainly something I look at every day, seeing bariatric patients.
Is the bariatric surgery of 2016 vastly different than 2006, 10 years ago?
They were still doing bariatric surgery in 2006 laparoscopically, which I think is very important because that is the way we perform the surgery these days, is laparoscopically. In the 70s, before the 90s, in the 70s and 80s, it was done using open, larger incisions.
You literally had to cut them open.
Exactly. And in the 90s, it transitioned to laparoscopic or smaller incisions, and we were able to get the same surgery done using baby incisions.
If we could just put that on hold just for a second, and could I ask you about like liposuction, things that suck the fat out? Mm-hmm. To me, it seems dangerous to do that, and I guess because of what I've heard. What are your thoughts on that?
Liposuction is a plastic surgery done for patients with excessive adipose tissue, and it is for purely cosmetic reasons. It doesn't fix anything to help patients lose weight in the long term. Bariatric surgery helps them lose a lot of weight, gives their body a new set point, and provides them with durability to not only lose the weight but keep it off for years to come.
Is there a cutoff weight where you recommend not doing bariatric surgery? Because some people are so obsessed they have to be as thin as thin could be.
Absolutely. There is criteria, national guidelines. Patients that are candidates for bariatric surgery have a body mass index, is how we measure weight in bariatric surgery. Body mass index is a calculation of their height and their weight, and it has to be greater than 35 for them to meet criteria for surgery. And if their BMI is greater than 35, they also must have a disease state such as diabetes or high blood pressure. Otherwise, if their BMI is just greater than 40 and they don't have any associated diseases, then they are still a candidate. So BMI of greater than 35 with the disease, or just BMI of greater than 40.
How much discipline is required on the patient's part in order to maintain the results that the bariatric surgery will cause to happen?
A lot of responsibility.
It's a
major life-changing decision for the better. It does require them to abide by dietary changes, and they are lifelong. The surgery does help them lose a lot of weight, but there is a lot of responsibility on the patient to maintain their bariatric surgery for life.
So if they went to you and you told them that, and they said, wait a minute, you mean if I skipped the surgery and just did the discipline, I could lose the weight? Would that be true?
There is a rigorous process in order to get surgery, and they have to go through usually 3 to 6 months of physician-guided weight loss before the surgery can even take place.
Oh, really? And
so there is a rigorous process. We can't just see the patient and book them for surgery. It's not that simple.
That's good to hear. So the 3 months, what does that tell the doctor?
It tells the doctor that they are compliant and that they're serious about making life changes.
Okay.
And that they will continue that post-operatively.
Would they see weight loss in those 3 months?
They will, and it'll be a little bit of weight loss, which is good for them to lose a little bit of weight before surgery. And also, before the operation, they're put on a very specific diet to help the surgery go more safely. So there are lots of things that we're doing to make sure that they get to surgery, have a safe surgery, and have a good outcome.
Does it hurt? I mean, after when you're recovering, because I know when my brother had his operation years and years ago, talking stomach stapling before even this was, you know.
I forgot. Well, his brother did it.
After that surgery, he was kind of ugly in his disposition for a couple of weeks.
I can
it
imagine
really hurt.
if he had open surgery, it's probably more painful. There is still some discomfort even after laparoscopic surgery. The first night after the operation is usually the worst with pain, but we have good pain medications, good medications for nausea, and after that, patients do better. But the first night is probably the most uncomfortable for them in the hospital stay. But that's the reason why we're doing it laparoscopically, to minimize the discomfort and to have them discharged from the hospital sooner and back to their normal activity a lot quicker.
Wow.
Lauren, are we okay with taking phone calls?
Yes, absolutely.
Listeners, okay,
Absolutely.
if you would like to call and ask Dr. Griffin a question, you are welcome to do that and invited, in fact. The number here is 352-622-9622. Dr. Reginald Griffin is Lauren Debick's guest, and Lauren is from Ocala Health, so I'm assuming that you work with Ocala Health.
Absolutely.
Is there a difference between gastric surgery and bariatric surgery, or are they almost the same?
You know, whenever bariatric surgery was first starting, it came from gastric surgery back in the 60s. Patients were having their part of their stomach removed, usually for peptic ulcer disease or for cancer.
Oh.
And what they noticed is that obese patients with diabetes not only lost weight, but their diabetes started going away too. And so that's where we got a lot of information that we have now for bariatric surgery. Not only does it help them lose weight, but it fixes a lot of their diseases, such as type 2 diabetes, hypertension, high cholesterol, and obstructive sleep apnea.
So help me understand biologically what the difference is. What is gastric versus bariatric?
Gastric surgery is usually either for benign or malignant disease, such as gastric ulcers or gastric cancer. Bariatric surgery is for morbidly obese patients to help them lose weight, and there are two types. There's gastric bypass and the sleeve. We were doing lap bands a lot in the early 2000s, but lap bands have fallen out of favor because they didn't work as good as the sleeve and the bypass.
So what's the sleeve then?
Sounds like a rock and roll name, doesn't it?
I know, the sleeve and the bypass.
Yeah, it's very easy to remember those two
Like the
things.
edge on the
Yeah, right.
sleeve.
Exactly.
And I'm in a lap band, too.
And that's how we refer to both of those operations. You're
that right?
either getting the sleeve or you're getting the bypass.
Okay.
With the sleeve, 85% of the stomach is removed. It leaves
How
the
much?
body.
80?
85%.
Wow.
And you're left with a tube, banana-shaped stomach that remains. And what we're seeing is that patients are losing weight. By removing all of that stomach tissue, we're removing those cells that produce a hormone called ghrelin that really drives hunger. So after that sleeve operation, the patients feel less hungry because of a positive hormonal response.
But don't you still have to eat to maintain yourself or you die?
You do.
That
and
tiny tummy?
Absolutely.
Shape
And
of
so
banana.
that's part of the dietary modifications that the patients have after the operation, sticking to more things like protein, healthy vegetables, and trying to minimize carbohydrate intake.
If you're trying to figure out if you might be a candidate for bariatric surgery, you might want to call. We'll take a break and take calls after the break. The number is 622-9622.
The weather is brought to you by myfwc.com. Safe boating is no accident. Sunshine mixing with clouds and hot on this Thursday, high 94 to 98. Clear to partly cloudy and warm Thursday night, low 74 to 78. On Friday, partly sunny and hot with a thunderstorm in spots in the afternoon, high 94 to 98. And more the same on Saturday, partly sunny with a stray afternoon thunderstorm, high again 94 to 98. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Hello, gorgeous.
Hi, this is Becky at Hello Gorgeous Salon. Let's get rid of those sun-damaged ends and faded out color and get into something rich and vibrant. It's time to get that new look started. So call today and set up your appointment at Hello Gorgeous Salon, 351-5358. Hello Gorgeous is a certified Brazilian blowout salon. We can tame those locks, leaving your hair healthy and shiny with a Brazilian smoothing treatment. And whether you're going on a job interview or out on a date, your hands do a lot of talking. Manicures are a must. Hello Gorgeous is a full-service salon, so let us help you make a great first impression. Call us today to set your appointment at Hello Gorgeous. Our number is 352-351-5358. Again, that's 352-351-5358. Hello Gorgeous is conveniently located in the heart of downtown Ocala, right next to the historic Marion Theater. And don't forget, we also do men and children's cuts too.
Hello, gorgeous.
Need to sell your house? Discover how to easily sell your house fast and for full price in today's market. Join us live this Friday, 9:30 a.m. for Mr. Ocala Real Estate Today. Sell your house now. Full price, fast close. Guaranteed. Call 352-282-3080. 352-282-3080. And join us live right here, 9:30 a.m. Friday.
Hi, I'm Leah Caruso with Strive Rehabilitation, inviting you to join me Thursday at 11 a.m. for Health Matters. Ocala Health and Strive have teamed up to bring you the latest information on good health services available to you right here at home. This vital information will help you make informed decisions about your health. So don't forget to join me here at 11 a.m. Thursday. It's news you can use from Ocala Health, Strive, and your friends here at WOCA.
Putting the local back into radio. 24 hours a day, 365 days a year. WOCA News. Variety. Information. Now. Keep your arms and legs on the inside at all times.
All right, 18 minutes after 11 o'clock. Do you know what the temperature is right now? Hold on, I'm going to refresh this thing because this is my new thing, Lauren. It's 88 degrees, but the heat index, 105. I just love this whole heat index thing. I just love it. But there's actually wind chill on this chart too. 88 degrees is the wind chill factor. So if you're in the breeze, it only feels like 88, which is what it feels like if you're not in the breeze, which is kind of weird. In the studio, we are talking about bariatric surgery for weight loss purposes. Dr. Reginald Griffin is in the studio. It sounds like it helps with type 2 diabetes as well. Maybe we can ask some questions about that. Lauren Debick is our host who brought in Dr. Griffin, I guess you say it that way, from Ocala Health. And you're at Concierge Bariatrics. Where's that?
That's correct. Concierge Bariatrics is the name of my practice, and I'm located in Deerwood off 17th Street.
Oh, is that right? Mm-hmm. We're going there Friday, tomorrow.
Yes.
Not to the bariatric, but to there's a nursing home over there.
Oh, gotcha.
That's where we play music.
Yeah, I've been there over 2 years, and things have been going very well.
Tell me a success story. Tell me somebody who came in and was just miserable, and now they're doing fine.
Oh, I've got a couple I can think of right away. One lady came to me with morbid obesity, and she also had really bad gastric reflux or heartburn.
How old?
She was in her 40s, and we decided on gastric bypass because nowadays, patients with morbid obesity and heartburn, the gold standard of treatment is gastric bypass. It fixes the gastric reflux. And after she got her gastric bypass, she lost a lot of weight, and her reflux symptoms went away.
Wow, that's amazing.
Wow, how much weight did she lose?
She lost around 100 pounds.
Wow.
I have a...
Changed her life, made her life better.
Absolutely.
The word morbid in morbid obesity means you could die from it? Is that what that means?
It significantly increases their risk of mortality 10 times more than that of the average individual from early death from stroke, heart attack, or kidney disease.
Wow. Did she have children? Does she have children?
Yes, she did.
In my mind, I'm trying to picture her lifestyle. It must have changed. She can play with the kids, has more energy. I'm guessing all these happened for her, right?
Absolutely. And a lot of times after pregnancy, weight gain can happen after one or multiple pregnancies.
During pregnancy, too.
Exactly. And afterwards, they have a lot of difficulty losing weight. And a lot of it has been blamed on eating too much and sedentary lifestyle. But what we've become to understand is that is really not all there is to the equation. It really has to do with...
There's something else.
There is something else, absolutely. And the gastric bypass and the sleeve essentially fix what that something else is and helps them lose that weight.
So would this lady who you helped, is she one of the featured speakers in your support groups or the education of receiving this?
I encourage all of my patients to attend support groups and post-operative education classes, and Lauren can certainly talk about that a little bit.
Ocala Health does have several support group options available for those considering bariatric surgery or those who already have it. We have our monthly bariatric support group, which is the third Thursday of each month, and that's from 6 to 8 at West Marion. And we also have informational classes for patients who already had bariatric surgery, and those are held at Ocala Regional the second and fourth Thursday of each month at 1:30. And if anyone wants any more information about those support groups, we would encourage you to call Kelly Potenza, and she is our bariatric clinical coordinator, and she can be reached at 352-401-1362.
Okay.
And I do want to talk very specifically about diabetes. Not only is morbid obesity an epidemic in this country, but type 2 diabetes as well. And that's the wonderful thing about gastric bypass and the sleeve, is that what we have learned in many societies, worldwide societies, Diabetic Association, American Heart Association, all of these studies are now saying that gastric bypass is the best treatment for type 2 diabetes in patients with morbid obesity.
Really?
Over medications, over diet, it works better, and study after study has shown that.
Do we understand why?
Yes, it changes the production of gut hormones. So by altering the anatomy of the intestines, we have a positive change in gut hormones that help us better metabolize sugar, especially in patients who are obese who have diabetes.
Does life changes when you talk about that? If a person that comes to you, if they're a smoker or if they drink, do you try to ask them not to?
Yes. Anybody who is a current everyday smoker is not a candidate for bariatric surgery because smoking can cause complications after bariatric surgery.
Oh, really?
So smoking cessation is mandatory before the operation.
Oh, wow. So the name, Concierge Bariatric, did you name the clinic?
Actually, my older brother thought of that name for
Your
me.
older brother. Yeah. I love the name. and a concierge to me is like where you go, like when you're in Europe and you say, oh, I don't know what I'm doing. And you go find the American concierge.
It's all about attention to detail, very specific.
So that's
patient
why.
care.
Okay. I'm trying to figure out the name. Okay.
Can people go back into their lifestyle after the surgery? Say somebody's an athlete and they have to have the surgery. Can they be athletic again? Can they?
That's the great thing about laparoscopic surgery, earlier return to normal activity. Using the small incisions, there is a weight restriction. So 2 weeks after the operation, we don't let them lift anything more than about 15 pounds because we don't want them to get a hernia at one of the port sites. But after 2 weeks has happened, after healing has occurred, then they can go back to doing their normal exercise regimen.
Oh, really? Let's see. I wanted to ask you about you.
Oh, absolutely.
2 years. You said you've been there, right? Did you move here from somewhere else?
I'm originally from Ocala. I was born here. My parents are from here and live here.
Is that right? Did you move away and then come back?
I did. I went off to school. That was about 15 years.
Where'd you go?
Undergrad at UF.
Okay.
And then I went to medical school at Saba University, which is in the Caribbean.
You look so young. I
Wow,
don't think you have this many years in you.
And then I moved back and did my residency in general surgery and bariatric surgery at University of Florida.
So the person who's listening right now who's not sure if he or she is a candidate, is there something you can tell that person so they can?
Well, you won't know until you consult with a bariatric surgeon such as myself. If you've been told your body mass index or BMI is greater than 35, then you are a candidate for bariatric surgery.
And what is the formula for that? How do you figure it? It's weight and height? Is that
height, weight, and gender.
And gender.
gender.
How do you use gender as an equation number?
Men and women, we used male or female, height and weight to come up with the body mass index. We have to use that because a lot of times there can be athletes who are very muscular and their BMI, they may weigh quite a bit, but their BMI is not that of a morbidly obese person.
Does this affect how people go to the bathroom too? Because sometimes people have to have those bags either permanently or for a temporary amount of time.
Patients undergoing an elective sleeve or a bypass it doesn't usually change their bowel habit. If they were having issues preoperatively, sometimes they can still have those issues afterwards. There are no ostomy bags or bowel bags after these operations.
Oh, okay.
No. Sometimes patients can develop bowel habit changes after these operations. Sometimes patients can get diarrhea. If they eat too much carbohydrate or sugar, it can cause a diarrhea response. But that's not typically one of the major effects of the operation. Typically, their bowel habit changes stay pretty much where they were preoperatively.
So I found online the BMI calculator, and I don't know how accurate this is. It's just something I did real quick. So if you are 6 feet tall and you weigh 294 pounds, then your BMI is 40. And that's the magic number, 40?
40 is the magic number without a disease.
This
yes.
doesn't differentiate between men and women, though. This just has that number, right?
Yeah, that's important to be able to choose gender.
Oh, it does say BMI chart for men. Oh, okay, so that was for men. Okay, I didn't see the top of it.
So does that number change then? 40 for a man and a different number for a woman?
It could, because women are typically not as tall and they have different fat distributions, so the BMI could be different for a woman.
Before we went on there, I think I was telling you about somebody who had bariatric surgery and needed to take vitamin B, I think, or one of the vitamin Bs for the rest of her life. Is that still true?
Yes. Vitamin deficiencies are possible after these operations, more so with the bypass because the stomach and first part of the small intestine is being bypassed. What we do to try to prevent vitamin deficiencies is we check the vitamin levels preoperatively to make sure they don't have any pre-existing vitamin deficiencies, and then we check them 3 months post-operatively, and if they develop any, then we replace them specifically. Typically, if we do see vitamin deficiencies, it's more common in women, and we see things like iron deficiency and vitamin D deficiency. B deficiencies are a little bit more rare, but sometimes patients do have to be on vitamin B1 or thiamine or vitamin B12 replacements.
Okay.
And as long as we monitor them and the levels are adequate, then they don't have to necessarily be on the vitamin lifelong, but they do have to be on it initially if we do identify a vitamin deficiency.
And does this also include emotional counseling as well?
Oh, very important. That's why support groups are so important for bariatric surgery patients. Bariatric surgery patients have 2 doctors in their life. They'll have their primary care doctor and they'll have their bariatric surgeon. Even if they move, it's very important for them to establish with another bariatric surgeon in the town they move to.
Oh, really?
And any qualified hospital who does bariatric surgery will have support groups, which I think are very helpful for these patients. because it gives them a safe environment to be able to talk about what they're going through. A lot of the other patients are going through the same thing, and they're really able to help each other.
Dr. Reginald Griffin, thank you for coming in and sharing your expertise with us. Lauren Debick, thank you, as always, for coming in and for bringing Dr. Griffin here. We've got 30 seconds. Give the contact information again, phone numbers, and any other way that somebody who needs to know more can find out more.
Absolutely. So if you have any questions about our bariatric program or really any of the services offered by Ocala Health, we encourage you to call our health hotline, and the number for that is 1-800-530-1188.
All right. And that's the same number I called when I got the ball rolling from my leg.
That's right.
This leg thing is like months. Takes months to fix something. All right, we will take a little break and be right back. Fun with Joe is all about pasta today. It's National Macaroni Day. We'll be right back.
Fox News Radio, I'm Lillian Wu. In the hot seat on Capitol Hill, FBI Director James Comey, who recommended no criminal charges against Hillary Clinton in her email probe. Many Republicans keeping